Hey, future medics. It's me, Tina, your medic mentor. And today we're going over medication that should be reviewed from your EMT class. It's nitroglycerin. Nitro is a powerful vasodilator and part of your chest pain toolkit. Nitroglycerin is the generic name, and nitrostat is the brand name, but we all just call it Nitro. Now, being a vasodilator means that it opens up all of the vessels in the body. It's not selective, it's all of them, from your head to your chest to your legs. All the vessels in your body will dilate and get larger. This is part of the chest pain toolkit because it helps increase flow to the heart, which lowers oxygen demand on the cardiac muscle and therefore, hopefully, if there's a clot in the way, reduces the amount of damage to the muscle. Indications are going to include chest pain that is presumed to be cardiac. So, not someone who's been coughing for 5 days and their chest is sore. We're going to want someone who just suddenly had an onset of pain, or they've had pain in the center of their chest and it's been hurting there for the entire day and it's only getting worse. Things like that tell us that it's actual cardiac pain and not something else. Another indications for this is going to be CHF, congestive heart failure. The dose for this one is 0.4 milligrams sublingual, so under the tongue, and that can either be a tablet or a spray. Now you can repeat this every 5 minutes up to 3 times, and this is important because the vasodilation that happens in the blood vessels, the blood pressure will drop because the container got larger, right? That blood pressure drops. So you need to make sure every time you're getting this that you check a blood pressure before you give it and make sure the systolic is at least 90. If it's lower, you're in for a ride, let me tell you. The effects of this medication usually go away in 5 to 10 minutes, so it's pretty short acting. But another really important thing you need to know is they cannot have this medication if they have had an erectile dysfunction medication in the last 24 to 48 hours. Viagra, Levitra, Cialis, those medications couple with nitro in a very dangerous way and they drop that blood pressure faster than anything you've ever seen. It will scare you and scare the patient. It's a whole thing we'd like to avoid. So make sure you ask. Is it uncomfortable to ask? Yes. Is it your job? Also, yes. Also, yes. So ask and implore that the answer is important. Okay? Do not give nitro if they have had these medications in the last 24 to 48 hours. Okay, you're going to remember that. So, moving forward, side effects, hypotension, headache, dizziness. They wear off pretty quickly. 5 to 10 minutes, they're gone. Okay? Contraindications, non-sensitivity, and hypotension. If they're already hypotensive, obviously don't give it. But you knew that because it's review. You knew this one. Okay, so here's your takeaway. Nitro is a very powerful vasodilator, and it's pivotal and so helpful in your chest pain toolkit, but it is not without the risks. So make sure you ask about medications and know your drug interactions. But that's it. Another one knocked out. You're doing such a great job. I'll see you for the next one.